So the infection rate that we are dealt with, that the state shares with us, is that to date, 1% of the population has been diagnosed as COVID positive. These has resulted in 11,270 deaths to date, a fatality rate of approximately 2%, which is less than half the global average. There have been dimensions to this that have been obvious to everybody, starting off in the Cape, then shifting off to Gauteng, now shifting to other areas. But unfortunately, what happened was that cracks started showing up in their data. Amongst the Muslim community, for example, 2% of the South African population is Muslim. And they account, by their own reckoning, 10% of the fatalities. And there's a great deal of hand-wringing in the Muslim community as to why the death rate amongst Muslims was almost 5 times the national average. So it did cast doubt on the veracity of the state's data, simply by virtue of the fact that there was nothing else to counter this information. Basically, independently collected data was showing something very different to what the state was telling us. Data released by the South African Medical Research Council shows a very similar trend to what the Muslim community was saying. So the period that we're talking about here with COVID coincides with a decline in deaths from vehicle accidents, industrial accidents, violence, murder, etc. But the Medical Research Council data can differentiate between natural and non-natural deaths. And this is what their data shows. The gray band running through the middle of this graph is a 95% confidence interval of how many deaths, how many fatalities are expected in any given week. You can see that from approximately June, the actual number of fatalities, as shown by the black line, has surged way above that the upper bounds of that 95% confidence interval. These extra deaths, as SAMRC refers to, can only be accounted by COVID. So when we are looking at the period in question, and this goes to approximately 3 weeks ago, we have, according to Medical Research Council, an extra, this is over and above the grey band, an extra 33,000 deaths in the South African population. At that time, 3 weeks ago, the official tally of COVID deaths was 1/4 of the number. So this would imply, amongst other things, that the official tally of COVID deaths is possibly not half the global average, but double the global average. Compounding this is that for the first time in decades, there was no flu season in South Africa. Largely as a result of us wearing masks and being isolated, we have not had the traditional flu season in South Africa and in many other countries. Typically, the number of people that die from flu each year is around about 5,000. And this would have put us very low on the number of deaths. So what we could argue is that the actual number of deaths attributed to COVID-19 is 33,000 odd at the moment, plus the number that would have died from flu. So at one level, it seems that the data is highly questionable.